So this advisory committee for the immunization practices, I imagine most Americans didn't know it existed until RFK Jr. fired all of its members. What does this committee do? How does it work?
It's a really important committee, and it's been a model for the world in transparent, fact-based, effective decision making. Every presentation is live streamed. Everything is available on the internet. When I was CDC director, we had people coming from all over the world to watch it. And the claim that has conflicts of interest is simply wrong. What the Department of Health and Human Services and CDC did was to post all reported possible conflicts of interest over the last 20 or so years on the internet. Of the current 17 members, one has a potential conflict of interest. That individual is a distinguished professor of pediatric infectious diseases. And as is the policy, she recused herself from all issues which she may have had a conflict of interest from. Her conflict of interest was that she's a researcher who studied vaccines. What's really important about this committee is that it gives guidance for doctors to know what to recommend to parents, what to recommend to seniors for what vaccines to get, and it determines whether insurance companies and what's called the Vaccines for Children program will pay for vaccines. So this decision means that potentially we'll have recommendations that aren't based in fact, that result in more spread of disease, and people will have to pay hundreds of dollars that today they don't have to pay a penny for.
When Secretary Kennedy talks of conflicts of interest, he seems to suggest that the committee members, the former committee members, have a pro-industry orthodoxy that effectively acts as a rubber stamp, to which you would say what?
There are many instances where the committee has decided not to recommend a vaccine. Just last year, a new vaccine, the RSV, which is for older people, new vaccine, important vaccine, bad illness, but as more people get vaccination, you can see some possible what are called safety signals. So there was a possibility, not proven, but a possibility that there may be a rare adverse effect. There's really no way to know this until millions of people get the vaccination, and therefore the committee restricted or limited the groups that are recommended to get the vaccine. So this is simply untrue.
How might this affect routine immunizations and the ability of insurance to cover them?
We're already seeing a decreased immunization rate. And when Secretary Kennedy says he wants to restore trust, the fact is that his activities over many years have been one of the main reasons there are questions about vaccines. The reality is that if there are lower vaccination rates, we will have more trouble controlling measles, which was eliminated in this country in the year 2000. And we're now having more cases and more deaths than we've had in many years, and whooping cough, which is increasing. The real concern here is that we're undermining, Secretary Kennedy is undermining and stopping a process that has been transparent, effective, and fact-based, and replacing it with we don't know what, but based on untrue statements, misinformation, and frankly, fringe beliefs.